Have you ever wondered what's really going on inside the mind of an expert doctor? You know, how they can look at a super complex case and just land on a diagnosis? Well, today, we're going to pull back the curtain on the doctor's brain and explore how experts actually think.
Our story starts at a very specific and, let's be honest, a very unwelcome time. 2:17 in the morning.
So picture this. A totally healthy guy, no medical problems, is suddenly woken up by this pain in his elbow. And it's so excruciating that he heads straight to the emergency room. His elbow is hot, it's swollen, it's incredibly tender. This is the medical mystery we're about to solve.
Now, this is where it gets really fascinating. You have the same patient with the exact same symptoms, but he's seen by two different doctors, and they come to two completely different conclusions.
Okay, so here's the case file both doctors were looking at. Healthy 47-year-old man, boom, sudden hot, tender elbow. Now, the lab results are key. They take a sample of fluid from his joint, and it is just packed with white blood cells. We're talking 140,000. That's a huge sign of inflammation. But, and this is a big but, a Gram stain shows zero bacteria.
So check out how each doctor framed this problem. The senior resident, who's still in training, sees the hot elbow and that massive white blood cell count, and his mind immediately jumps to pus. So his diagnosis? Septic arthritis, which is a dangerous joint infection. But the attending physician, the expert, they see something different. They focus on how suddenly it started and that negative Gram stain. To them, the WBC count isn't the most important piece of the puzzle. Their conclusion? You have to consider a crystalline arthritis, like gout or pseudogout.
And the final diagnosis? It was pseudogout, a type of crystalline arthritis. The expert was right. The resident, who got fixated on that one really dramatic lab value, he was wrong. So the huge question here is, why? This wasn't about one doctor knowing more facts than the other. It was all about how they process those facts. And the answer takes us deep inside the hidden machinery of how all of us think.
To really understand what happened, we need to talk about a concept from psychology called the dual process theory. It's basically the idea that our brain has two totally distinct operating systems.
First up, you've got System 1. This is your brain on autopilot. It's fast, it's intuitive, and it works by recognizing patterns based on everything you've ever experienced. Think about driving to work on a route you know by heart. You don't consciously think about every single turn, you just kind of do it. That's your System 1 in action.
Then you've got System 2. This is the slow, deliberate, and analytical part of your brain. It's what kicks in when you face a new or complex problem, like trying to solve a really tricky math equation or, putting together IKEA furniture for the first time. It takes real effort and concentration. So how does all this apply to doctors? Well, they use these two systems, but they have a special tool called an illness script. You can think of it like a mental playbook for diseases. Over years and years of practice, a doctor builds this incredibly rich, detailed script for every condition they see, storing the typical story, the key signs, and the expected lab results. So let's connect this back to our case. Both the resident and the attending were using their fast, intuitive System 1 thinking. But the attending physician's illness script for joint pain was just way more refined. It included the critical details that a sudden onset and a negative Gram stain point away from infection, even with that sky-high white blood cell count. Their intuition was simply better trained.
But what happens when that System 1 intuition is based on an incomplete script? Well, these mental shortcuts can lead to some really serious errors. Let's take a look at another case. This one seems pretty straightforward, right? A 29-year-old woman comes in with a fever and a cough. For most doctors, their System 1 pattern recognition is immediately just screaming pneumonia.
And that is exactly what happened. She was diagnosed with community-acquired pneumonia and sent home. But a week later, she's not getting better, so she gets admitted to the hospital, and they treat her for the same diagnosis, just with stronger antibiotics. 2 weeks after that, she's still sick, and a specialist is finally called in. The initial diagnosis just wasn't working. The specialist, the expert, did something different. They switched from that fast System 1 to the more deliberate System 2. They took a detailed history and uncovered all these crucial facts the first doctors missed. The symptoms had been going on for 2 months, she had night sweats and had lost 9 pounds, and, this is a big one, she lived in a recovery home where someone else also had a bad cough. The diagnosis wasn't pneumonia, it was tuberculosis.
And this is just a brilliant illustration of a few classic cognitive errors. The first doctors fell victim to anchoring.
They got stuck on that initial idea of pneumonia. This led straight to premature closure, where they refused to reconsider that diagnosis, even when the patient clearly wasn't improving. And at the root of it all, their illness script for TB was incomplete, so their System 1 pattern recognition missed it entirely.
So how do experts avoid these traps? Well, it isn't just that they have better intuition. They have a better process for knowing when not to trust their intuition. They've mastered the art of blending intuition with analysis. And this blend of intuition and analysis, it's not random. It's a structured process. It's actually captured in a framework that was developed by studying experts like firefighters, and it's called Recognition Prime Decision Making, or RPD. It's a way of deliberately structuring your thinking, especially when you're under pressure.
It really works in 3 steps. First, you pattern match. Does this case fit a script I already know? But crucially, experts also look for red flags, features that don't match. Second, if the pattern is unclear, they search for data. They deliberately switch to System 2 and start hunting for more information, just like the TB consultant did. And third, they simulate the outcome. They run a mental pre-mortem. They ask themselves, okay, what happens if I'm wrong? Or even better, what's the one diagnosis I absolutely cannot afford to miss here?
All of this leads to a really profound conclusion about what it means to become an expert, not just in medicine, but in pretty much any complex field.
Because let's face it, facts are cheap now. They're easily retrievable. The real goal of training isn't to create a walking encyclopedia. It's to teach a process of thinking, a way to reason through uncertainty, to know when your intuition is reliable, and to know when you need to slow down and really analyze.
It all boils down to this simple but incredibly powerful idea. Knowledge is knowing that a high white blood cell count can mean infection. Wisdom is knowing when it doesn't.
And that leaves us with one final question that extends far beyond the hospital. In an age where we are all just drowning in information, where any fact is just a click away, the real challenge isn't acquiring more knowledge. The real challenge is, how do we learn to be wise?